introduced me to the medical school that I ended up going to, that I had no idea about. And so just having that background and having someone to support me in this like impossible dream is exactly how I got involved in medicine. Now, with dealing with kind of talking about the racial disparities that we all know and see with medicine, that is certainly something that I've concentrated my work with doing.
Thank you for sharing that. Shout out to Michelle over there. And shout out to all the great film directors for inspiring day in and day out, for all the work you do, for being an inspiration to all of our community members here.
I'll go next.
Michelle's amazing.
So actually, it's very similar to what she just said. I actually was on the campus of University of Houston here in Houston. I happened to be in the middle of a crisis. I'm a first generation college student, and I was struggling with the college climate. And it was a struggle. And I was actually going to student support services that the university offered. And I happened to see Dr. Bacon. Back then she was Casey Gehring. She's here in Houston, a part of the Paris Foundation, also a TRIO program. And she was actually advising another student, and I happened to be eavesdropping. And I heard her offering all of these wonderful things, including food on campus and free food. And so I was like, that kind of got my attention. But as time went on, I noticed there were also lots of gaps in the treatment for or culturally competent therapists. And so being one of those people who sought help and not being able to find someone that could identify with me or that looked like me really pushed the envelope for me. Like that was a driving force. And TRIO was a big part of that, student support services on campus.
Big shout out to SSS. I'm an SSS alumni myself as well. So I appreciate you sharing that. Brina, you want to go next and share your story as well?
Yeah, absolutely. I mean, first, I just want to say thank you to the doctors, to Dr. Vasso. Oh, I went to Upward Bound with your brother, right? Oh, that's funny. I was the class of 2006.
Yeah, William.
Yeah.
Awesome.
And, you and my brothers were in the same class. Yeah, it's a whole family affair.
Yes, absolutely. And I mean, just kind of similarly, I chalk up, my success to, the successes that I've been able to have to this incredible network, right? Upward Bound has been instrumental to me personally, to my family. So many of us have gone through the program, and it's helped us get into school and all of that. And in terms of how I got into the work of public policy, I was actually on track to being a chemistry major in college. I was chemistry and social and cognitive neuroscience was what I was studying. And it was the fall of my senior year that I took a couple of courses on mass incarceration in the United States and on urban social problems and sort of inequality, where I said, like, this is what I need to do. This is what I need to work on. This is how I want to spend my time. And that's how I pivoted into public policy. I would say that in terms of my day-to-day work during COVID-19, during the pandemic, has been a 180. Right, I completely shifted. So I work at the mayor's office, as Justice mentioned, and I work in a department called Intergovernmental Affairs. And I like to describe it as like Olivia Pope, but no glamour at all, right? So my team is sort of we're the troubleshooters, we're the messengers, we're the crafters, we're always trying to figure things out. And the way that we usually split our work is, according to the functions of the city, right? So the city has public safety, the city has housing and health and human services, right? And so my portfolio, normal times, has always been to focus on the city's housing crisis and how we create more units and get more people housed, how we create more jobs, in, you know, how we strengthen our labor unions, right? Because we're a worker town. And so when COVID hit, everybody on my team and actually in most of the city has shifted to a crisis response mode, right? So we went from, you know, being oriented around the functions of the city, right? You know, these things I just mentioned, to what are the things that New Yorkers need the most right now to get through this crisis, right? So we stood up operations to source supplies, right? And just kind of begging from every single corner of the globe to send us more supplies, to sell us more supplies, you know, anything like that that we could do. We also shifted toward a food operation, right? So we knew already that we had over 1 million food insecure people in the city of New York, but now with the crisis, this was only going to get worse as people are losing their jobs and going through a lot. And so we've stood up a couple of things, a couple of just brand new programs from scratch, from one day to the next. And in my job, which is usually one about, again, messaging and talking to people and getting information out there, has been all across the board, from, you know, helping to set up operations, make new connections, to, you know, the same kind of how do we keep people informed, it, you know, enable them to make better decisions for themselves given their circumstances.
No, thank you for sharing your story. I mean, you tune in on the news and social media, et cetera, and you see everything that's going on and all the responses that are being put forth. So I immensely thank you for that response and the way in which you all have been responding. Brian, would you like to share your particular experience as well as to how you got involved into the current line of work you're doing, and just kind of how you adjusted to kind of suit those needs?
Yeah, absolutely. I have to start with the disclaimer first. So like everything I say today is my own personal view. It's not representing the Congresswoman. It's not representing AIT or anyone else in Congress or anywhere. It's strictly my own opinion, and I take full responsibility for what I say today.
It's like I second
I third that.
Everybody, the full disclosure. Thank you for that.
Yeah, thanks for doing that, Brian. We'll all take that as cover.
It's all good. It's all good.
All our disclosures.
It's like the government standard, right? You can't go to a government talk at all about people saying this is my own personal view.
Yes.
All right. So you heard, we're on the record. We're all representing ourselves here today, apparently.
For sure.
So I got him. To answer the first question, I like to say yes to new opportunities, right? So I come from a pretty rural area of Southern California, but it's not that far from LA and Riverside, where I went to college. So you have this interesting mix of like urban, rural. But what I saw a lot when I went to school is that like rural communities like mine often got left behind, right? So lots of communities are disenfranchised, right? For various reasons. And so that was one of the things that really like stuck with me as I pursued my career. When I went to graduate school, there were very few students in the program, and this is a school that prides itself on diversity by every metric, right? You take any metric of diversity at UCR, and UCR is like in the top. But when you go to the graduate program, all of that disappears, right? You have very few students of color, you have very few students who are first gen, very few low-income students. And so for those of us that did come from one of those backgrounds, it was a shock, right? And here I was at this graduate program that's considered one of the world's best in the field I was in, 45 minutes from my home, and they didn't know anything about us. They disparaged the community I came from, and that was really like disheartening to me, right? It was one of those things where it's like, okay, this can't stand. So what can I do about it, right? So I helped like form an outreach group that would go and work in the community, right? And do research and do education and do all the things that we thought were important to do in our community. And from there, it was like, okay, where can I keep doing this? Where can I keep making an impact for communities like mine, other communities that, you know, aren't getting the access that they need and deserve? And it's just kind of taken me from one spot to another. I was at Harvey Mudd for a few years, doing some really cool research and community engagement work there. That led to a job in New York City where I got the luxury of interacting with Fiorina in person, and we got to do some TRIO alum stuff there. And then it brought me to DC because I was like, you know, what's the ultimate way to impact communities? And that's policy, right? I mean, not to say the grassroots doesn't matter, and I'm a big fan of the grassroots, that's where I come from, but the other side of that is policy, right? And both of those things need to happen. And so I really wanted to get that experience in policy. and found a fellowship program that would allow me to bring my skills that I cultivated as a scientist to the policy arena. Adjusting to my role, I'm going to like echo a lot of what Fiorina said. I'm on the health team for the Congresswoman. And so you can imagine during a pandemic, the health team becomes critically important. And we shifted again from the big issues that we were working on, lowering drug prices for people, increasing quality of care in nursing homes, to what do people need during the pandemic? And it turns out those same things are what we need, right? We need access to treatments and vaccines once they become developed. Nursing homes are hotspots for this, so we're really working on a response to that. But it's, what are all the different things that communities need right now to either respond to the pandemic or to prevent an outbreak from happening in the first place? Yeah. And so it's been a big shift. Congress is never meant to be teleworking. Congress is meant to be an in-person sort of thing by design. So that's been a big shift, switching over to video conferences and telephone calls and that sort of thing. So that's been a big challenge, but a big learning opportunity as well for all of us.
No, thank you for sharing that. Thank you for giving the disclaimer as well. You segue perfectly into our next question, because you all had mentioned this particular need that you saw, right? Whether that was in the medical field, whether that was in policy, whether that was in particular forms of counseling, et cetera. You said, look, I saw a need. I saw something was missing. I wanted to be able to provide that opportunity. And you all individually spoke about how TRIO assisted with that in some capacity, whether it was a director or a counselor or just an opportunity that you had going through the program. And I would like to also just think about, what does that now look like in the context of TRIO? Right. So what role does TRIO play in all of this as alumni, as individuals who've gone through this program? What do you see the role through your own individual experiences of going through the programs, et cetera? What do you see that, and how could TRIO alumni help support during these times, right? You mentioned the different needs and function areas and crisis response, et cetera. Do you see any particular way that TRIO alumni could help in certain capacities in those areas?
Absolutely. If I may, so there are 5 million of us, approximately, right? TRIO alums who have gone through different programs and who TRIO has helped in some way. And for me, I mean, maybe it's because of where I am right now and thinking about policy advocacy and thinking about policy and the role of policy in this response and recovery. And I really see the role of TRIO as uniting that alumni voice for the response and advocating for resources to the hardest hit communities. Sorry, that is my mom.
No, hey, Mama Sanchez, what's going on?
That's amazing.
I'm trying to say hey.
Using the voice that we have to be a part of this response, to advocate for resources in our communities, but also, to the point about, the big role that for me, Michelle, my TRIO director, has played in my life, right? TRIO directors and teachers and counselors and staff are such a big part of what students have to lean back on, right? And so in communities like mine, I still live in the Northwest Bronx, where we don't have as much access to mental health services, right? We should be advocating for more, but we also should be trying to be there for our students in the different ways that we can.
No, thank you for sharing that.
Yeah, I think this is probably, for everyone, obviously, the most challenging time for TRIO and the people it serves, right? Because I remember being a student, a lot of the care that I needed was one-on-one, someone seeing me in person and being concerned about, the way I was looking or feeling, or someone who's actually touching my shoulder and wanting to look over my report cards. For me, I can just only imagine how incredibly difficult that's going to be going forward. And that's what I know that we need as TRIO students. you know, so I mean, I guess kind of increasing those phone calls, those like contacts with emails or text messaging, would just be at least minimum what can be done here, because I think it's going to be really, really, I worry about the impact this is having on our students. And especially, I mean, TRIO targets our most vulnerable, right? People who don't have access to healthcare. The education system is already wonky, you know, transportation, food, insecurity. I just kind of imagine how overwhelming it must be when like the directors and administrations thinking about how to best serve our students.
For sure. All the TRIO directors on the participants, we deeply appreciate you and all the work that you
Absolutely.
do. So big shout out to all the TRIO directors and counselors that are currently tuning into this session here.
I wanted to just add to some of that, what we're talking about, you know, especially with being in mental health.
Yeah.
A lot of, I would say about 90% of my clientele, unfortunately, don't even have access to internet. So we haven't had the luxury to do, to go completely, you know, telehealth. Most of my staff is still out there seeing clients and having to go to their homes. And instead of addressing anxiety, we become tutors, right? So, so there is a dual role that we're having to play in the community, not just being therapists, but having to advocate for our clients that don't even have access to the internet. So I live in the Metro Houston area, but you know, you would think for the most part that we would have programs out here that would provide internet services, and there are lots of them, right? But our kids can't even afford to have that access. You know, it's subsidized internet, and they can't afford it. Either they can't afford it, or the excuse that we've been getting is we don't service that area, right? That area, right? So what we've been doing is we set up, we got separate phones where we kind of set up numbers where they can call us, they can chat with us. You know, we've gone completely virtual in the sense that we are constantly checking our phone, like, you know, is such and such okay? Because like the other panelists said, we are in the middle of a crisis, and the irony of this crisis is the increased amount of stress, and then how we crave connection with other people, right? And we can't do that. So TRIO I think can play a huge role in this. First, some of the things I've noticed that are helping us are peer chats. And we're doing a lot of virtual meetups where, according to your region, according to whatever side of town you're in, you kind of log in, and we do like virtual game night, you know, just things to keep us connected.
No, thank you for sharing that, Dr. Harris. And
actually, can I add to that? Like, I mean, Dr. Harris and Dr. Vasselin and Tiarina have all said incredible things, but I think TRIO is really powerful because because TRIO's model is making sure that students and people have what they need to be successful. And what people need can differ from one area to another. Both my parents are deaf, and I grew up in the deaf community. The COVID pandemic is incredibly difficult for people who are deaf and hard of hearing, because phone calls, which a lot of us switch to, don't work so well, right? Video conferencing, like my video is lagging a little bit. Like that's really difficult for people to use. So like TRIO alums can advocate for the needs of their communities and making sure that people have what they need during this time, right? Make sure that, like, whether it's, you know, a different mode of communication, whether it's food, like, you know, we heard in New York, whatever those needs are, that's what TRIO can advocate for. And as alums, I think we're really prepared to do this, right? TRIO is about learning how to do something that we haven't done before, right? And that our families haven't yet done before, right? So we're uniquely positioned and primed to do this sort of thing, right? To really make sure that, like, we can take that next step and do something big for our community.
No, thank you for mentioning that, and I'll segueing it together. You all bring up, I mean, immensely important concepts, right? And we talk about this concept of advocacy and what does that look like in this kind of like digital age and in this space, right? When people have access, when some don't. So we're currently in the space of navigating that and facilitating it as well. And shout out to Alicia Berry. She said, excellent reminders. The one-on-one check-ins and phone texts are incredibly important. Indeed, indeed. Dr. Harris, I just wanted to follow up with you briefly as well. Is there any like techniques or that any particular way that directors or counselors, et cetera, could utilize, right? Like, is there particular techniques that they could utilize as a director or as a counselor to better help and support some of their students, right? Everybody is taking on so much in different capacities. Is there any advice that you would give to any of the counselors, the staff, students, et cetera, on that?
The biggest thing that I can say, and that's a really good question, is to begin embracing this uncertainty, because it's really going to be our new normal, and that's the best way that you can combat the anxiety that you're going to get. It's okay to not be okay. You hear that a lot, and just begin creating what that looks like. If that means staying connected to people that are around you, or if that means creating new routines, because here's the thing, we're in isolation, and we all know what happens with isolation. And there's a study out there that says the increased amount of isolation is just as damaging as smoking cigarettes, right? So you've got to connect with people, whether it's virtual, whether it's going outside for a walk, catching up on, one of those documentaries that you've been wanting to see. I think the biggest thing, we've been in the virtual world for a very long time. However, a lot of us have been busy trying to navigate through school, right? So we didn't have a lot of time to do the social media. And I would actually encourage people, go on social media, go on Meetup, try to see if there's anyone else out there that are dealing with the same things. And there's very likely that there is. So I would just encourage you to begin embracing these uncertain times.
No, I appreciate you sharing those remarks. And I think that's a great reminder for all of us as well, to open up the window where we can, get some fresh air, to be able to lean into the discomfort and collectively understand that we're all processing this experience and trying to make sense of this uncertainty. What you had just mentioned also as well really segues into kind of like the last portion of our questions as well that we were looking at. And that really looks like, what does this future look like in these moments of uncertainty? What does the future of education look like in your fields and in TRIO? And what does it look like in your line of work? And I would ask, just where do we kind of go from here? How do we reopen, if whenever that happens or does, how do we reopen these institutions and places and hospitals and Congress and et cetera? And what does that necessarily look? What does that look like?
I'd say, especially for in medicine, I think I've had to become comfortable with feeling uncomfortable. And, generally speaking, as a physician, we kind of have this kind of, you have to project that what is happening, right? With certainty. But I think being vulnerable and, letting our patients or students know that you just don't know. It's the unknown is so evident, and just being vulnerable and letting people realize that I don't have the answer is probably one of the biggest, because you're setting expectations so that people aren't disappointed, with XYZ. The other thing that I think about the future of education is we have to get used to different modalities of learning now, more so than before. I think now really we have to figure out how to get tools that will work with telemedicine, teleeducation. And that's going to be different because I think a lot of us, we learn very much so with hands-on or one-on-one. And that is going to look really different in this COVID world. It just is. And it's going to be, like Miriam said, it's going to be present for a while. Like COVID is not going anywhere anytime soon, as much as we would hope so. So being comfortable with the uncomfortable and like understanding that you have to get different modalities for learning, for communicating, for even healing is certainly something that I've been thinking about lately.
Yeah, and I would add to that. I mean, you ask where do we go from here and sort of what's next? I mean, I have to emphasize from the New York perspective, but also just from the frontline communities perspective, right? Like people who are being the hardest hit, we cannot rush to reopen. We cannot rush to reopen. And so everybody use all of your megaphones and all of your platforms to drive that message at every opportunity, because that's our lives, right? Like that's rushing into that can cost lives. But I would say sort of the way that I certainly would love to see things go, the direction that I would love to see things go is in the frame of not how just do we get back to where we were, but how do we get to a place that even furthers justice, right? And actually helps communities to not just go back to where they were, but actually uplift them. You know, and one thing that comes to mind, you know, especially being with you all is, you know, the role of TRIO. I mean, TRIO has to keep doing what we're doing, right? This crisis stands to exacerbate the digital divide way worse than it has been, right? Sorry, not even the digital divide, but academic achievement gap, right? Like things will get worse because of that lack of access that Dr. Harris mentioned in certain communities. So we have to keep advocating for TRIO. We have to, it's so important. And especially in a way that we're asking those questions up front, not just what is the policy for reopening and how do we choose the industries, but how do we choose the industries and reopen in a way that is also helping those who are hardest hit and haven't had the opportunities historically to catch up and to recover in a just manner.
Thank you for sharing that.
Yeah, I guess just to add to that, I mean, other people have said this more eloquently than me, but like normal wasn't working for anyone, right? Like normal left the Black community out, left the brown community out, left poor communities out, left the disability community out, right? Normal left a lot of people behind, and we're seeing COVID play on that, right? COVID is disproportionately impacting communities because those communities were left out under our old version of normal, right? So as Pirina said, we can't rush to go back. And you know, Dr. Fauci was testifying in the Senate earlier, saying if we rush to go back, we're risking two things. One, we're risking lives, right? People will die if we rush to come back. But two, we risk any sense of progress that we had. You want to open your economy. Well, if people start dying, any economy you're hoping to save is set back at least a month, 2 months, 3 months, right? So what we need to do is prioritize the health and safety of people, right? While doing what Dr. Harris said earlier, right? Like, you know, our normal is going to look different, right? We're going to be uncomfortable with uncertainty. Like, it's going to be different going forward, right? Schools probably aren't going to reopen the same way they used to in the fall, right? And that's just where we are. So it's going to take, you know, a lot of creativity and a lot of resiliency and a lot of advocacy on our part as TRIO alums to rally the community around us to make sure that people aren't being left behind, and that, you know, what emerges is a much more equitable, you know, set of circumstances for everyone.
Thank you for
Some
sharing.
of the things that I've seen just as of lately is a surge in diagnosis, especially with ADHD. A lot of parents are noticing now that they're at home with their children that a lot of what the teacher was telling them, you know, they're actually seeing it play out in real life. So I've actually seen an increase in diagnosis, but the other part of what the future looks like, I would really like to see more research with in regards to telemedicine, because we really don't have that, right? We're kind of sitting in front of our screens and we're kind of doing trial and error, but I don't know what the efficacy looks like in terms of telemedicine, and that worries me, because am I effective? One of the things that a caveat to being a therapist is we kind of have to probe, right? We have to look at nonverbal cues. My office is sort of like a container for painful feelings, right? You leave them there and you get to go home into your home environment and you feel better. But now you're at home and you're having to deal with lots of distractions. So there's not a lot of home work-life balance. There's not a lot of being able to disconnect, you know, even as professionals. How are we engaging in self-care? How are we maintaining healthy boundaries? Because as we are being professionals and attempting to do all of this advocacy, we are not taking care of ourselves. And so I'm seeing a huge surge. And I wanted to put out there that there is, and just in case, you know, as far as the attendees are concerned, there is a text crisis counselor that's available 24 hours a day, and it's universal across the US. You can actually text the number 66746, and the message that you text to them is "talk with us." Talk with us, and you will immediately have access to a crisis counselor 24 hours a day.
Dr. Harris, can you say it one more time, please? Could you say that?
Sure. It's what you do is you text 66746, 66746, and you text the words "talk with us." It can be lowercase, uppercase.
Okay.
Yes.
No, thank you for sharing that. I think during these times, it's immensely important to provide those resources for the communities that are here at play, and trying to navigate these spaces and places. As we come to a conclusion, we got about 10 or so more minutes. If anybody of the participants want to provide any questions to our panelists, there is a question and answer portion in the box that can be written right there, and I will read them to the panelists to be able to answer upon the questions being provided, and we'll keep that open there on the side for individuals to be able to refer to. But as those questions kind of come on in, briefly earlier mentioning, we talked about aspects of the particular areas that are important to respond to. And we talked about areas like food and access and resources. And we talked about this notion of advocacy. And I'm curious, what in this particular context and role, what does advocacy now look like? Like, what can people do as students, as professionals, et cetera? What does it mean now in this current climate and context? What does that look like? Some people may be able to have political access and some may not. Some students may have internet, some may not. So for those varying the particular gamuts, is there any ideas or thoughts from your experiences or perspectives that can be provided for some particular actions or ways in which advocacy could look like during this time?
Yeah, I can start. I mean, the students today are probably a lot better definitely than me at social media. But, you know, one thing that I can share is that, you know, we notice at the mayor's office, right? And elected officials, right? We all notice when somebody does right? At Pierina, oh, what you say about me, right? there is a level of attention that is paid to that. So, I mean, it's sort of like, you know where you live, you know who your leaders are, find them on social media and talk at them, right? And if there's hashtags trending, use those, right? And you can actually have a dialogue that gets, if you don't get a direct response, don't feel like you haven't made your voice heard, because you have. Because what happens with with the social media and the things that get tagged to leaders is that they then go and they summarize them, and they see at the end of the day, oh shoot, 40 people today talked about housing. What are we doing about housing? What did people say we should do about housing? So I would encourage people to use your brilliant minds in that way, to tag people on social media and tweet at them or whatever.
Indeed, indeed.
I was just gonna say, for in mental health, there are a lot of us that there's various different levels of therapists, but oddly enough, there are a lot of managed care organizations that are not approving telehealth as a form of treatment. And just as Ms. Sanchez has said, you guys can very well Google your local congressman and start writing these letters, just kind of advocating for the access of this telehealth, because right now it's very important. In addition to that, what I was going to say is just offering support. You know what I mean? Like, and it's that simple, just offering support. I mean, whomever it is, and if you're in close proximity, to neighbors, just kind of, put a nice note on their door. Little things like that helps, because we're all dealing with it at the same level.
No, thank you for sharing that.
I would also.
On that,
no, sorry, go ahead.
Well, we'll have Brian, then we'll have Penina. Go ahead. We'll have Brian and Penina go.
Okay, well, now I would just echo those comments. Contacting your elected officials at all levels is really important. My Congresswoman loves to say that 10 calls is all it takes for people to start noticing. If you can't call, hit them up on social media, like Irina said, email them, do whatever it takes to get their attention. But advocacy isn't just at the political level, right? And that's what we heard. Check in on your neighbors, check in on, see how your community is doing. That's really critical. So making sure that we're all okay, even if it's just making sure yourself is okay, right?
Yeah. I think you're cutting out, Brian. Yeah, you're cutting in and out a little bit, Brian. Can you hear us now?
Yeah, I can.
Yeah, no worries. Hey, we're rolling with it. I think you talked about this. You left off when you talked about making sure yourself is okay, and then it cut in and out a little bit from there.
Got it. Yeah. So just adding on to the taking care of yourself, which is, if that's all you're doing, that's important, and that's not just all. That's a critical thing to do, right? Taking care of ourselves. And what's that saying? You got to put your own mask on first. We help others. But also just checking in on your neighbors and making sure.
No, thank you for sharing that, Brian. I mean, that's a critically important piece that Dr. Harris had mentioned as well, right? I mean, advocacy means something like checking in on our fellow neighbors, right? Advocacy is this action piece of seeing how our community is doing. Perini, I know you had a comment as well. I didn't mean to interject. I wanted to make sure that you were able to make your remarks as well.
Yeah, actually, I'm glad you went first, Brian, because what I was going to say is talk to your neighbors. So I know here in New York City, we have a couple of different ways to volunteer. We have an organization that is called New York Cares that is sourcing volunteers. And you can sign up to do wellness checks with your neighbors. And that's just, do you need anything? Do you need food? Do you need prescriptions, things like that? And so there's a lot of efforts that if you're in the city, you can definitely get involved in. I can put that in the chat box.
Yeah, that'd be great. Thank you for that.
Could I also add, just also on an individual and kind of like a medical standpoint, my #1 recommendation for advocacy is actually to try and seek out healthcare practitioners that look like you. I mean, I know we're unicorns and, we're few and far between, but quite honestly, the data is showing us that outcomes for our people is going to be different based on who is taking care of you. And so if someone who sees themselves, their mom, their grandma, in you. What's gonna be different with the kind of care you get is just that they think your life matters, right? That it's worth it. Even if that's just something that happens on a subconscious level, it happens. You know, I see it all the time in medicine. So that would be one thing that I think, just from an individual standpoint, or if you're working with a family member, is if possible, try to seek out a healthcare practitioner, you know, whether it's a physician, physician assistant, nurse practitioner, but, you know, access, whether or not you're going to be listened to, whether or not you're going to be taken seriously, that will likely increase if the person taking care of you looks like you.
No, thank you for sharing that, Dr. Vassell, and the importance of advocating for yourself and seeing and seeking those resources. And thank you all the panelists for being the living embodiment of that, of being those individuals that our young people in the TRIO community can come out to and utilize as a resource. To briefly look at some of the questions here, we'll have a couple of minutes and then we'll wrap up briefly with some closing remarks. So there's a question posed about the counseling service nationwide. That's 66746, talk with us. I'll post that in the chat again, as Dr. Harris had mentioned. And then there was two questions posed, and we could just briefly look at what these would particularly consist of. But a question was posed by Mr. Campos, Frank Campos. How will COVID crisis affect our students long-term over the next 3 to 5 years? What does this look like over the duration of their lifespan? And then another individual had said, resilience and grit are oftentimes buzzwords that are frequently used in student success, but what do these words mean in the context of a pandemic? What does grit and success look like in the context of a pandemic? And how does that ultimately impact our students long-term? And we can close out with that brief for a couple of minute remarks, and then we'll transition to the closing section.
I'll chime in. So in regards to resiliency and grit, when I think of that, I think of self-awareness, the ability to actually recognize when I'm in distress and when to ask for help. That is the only way that we're going to become resilient. You have to, one of the best teachers is life, right? So unfortunately, with a crisis such as this, we can begin to develop unhealthy coping mechanisms. Excuse me, and we have to be self-aware and know enough about ourselves to know when to ask for help.
Thank you for sharing. Does anybody else have any remarks that they would like to add in regards to affecting students long-term, or what is resilience and grit mean in this larger context of COVID-19 and navigating that?
Yeah, I wouldn't be surprised, especially if we don't kind of figure out how to evolve with teaching. I feel like in a few years, yeah, we may very well be, worse off in some instances. But at the same time, I guess with resilience, I think if you're still standing and feel like a human being at some point, that's resilience. We're in the middle of a pandemic, once 100-year type of event. We should certainly be doing away with the whole bootstraps thing at this point. I think if you're able to, in some cases, form a complete thought that you're resilient, quite honestly. I just hope that we realize that as a country, as people, to not really expect the ultimate from everyone. And that's from top down, physicians, nurses, students, caregivers, moms and dads. I mean, I just think all around, we just have to be able to be a little bit easy on ourselves.
Yeah, absolutely. I wanted to share, a couple of weeks ago here in the city, and like I mentioned, I'm in the Northwest Bronx. I want to say like at the beginning of April, it was every single moment felt like a moment of resilience, right? Because I remember feeling like there wasn't a single moment where there wasn't a siren going off, right? It was just constant. And then the data showed later on, right, that with when we started to see how hard hit this community has been. And I remember I actually had direct contact with somebody much earlier on that was COVID positive. And so I quarantined myself, just didn't want to bring the exposure to anybody else. So I went like 3 weeks without even going outside of my apartment, which, by the way, looks out to other apartments. It's that kind of New York City situation. But when I did go out for the first time, it must have been that second week of April. You know, that's when it just, you know, really drove me. Like, first of all, how fortunate I was that I could quarantine and I could be here. But going outside and seeing all of these folks going to work, coming back from work, right? They live here, right? They live in low income communities across the country, and they are our parents, right? Like as first generation college students, they are our parents, they are our uncles, they're our family members, right? And so being there for them and being the best version of you that you can be, because every moment is a success, is so much for them, right? Like you can be such a rock for them and thank them and uplift them and all of that, because it's these essential workers who are keeping us moving, right? They're keeping our shelves stocked, they're driving our taxis, they're doing all of this amazing work. And just, I think resilience looks like taking care of yourself and uplifting those people around you.
Thank you for sharing that. Thank you for sharing that.
And I have nothing to add. Like, I mean, these two women have said the most amazing things. So let them run things, right? Like I have nothing to add. Although I unfortunately do have to run to another meeting. So I'm going to have to sign off now. I apologize. But thank you for letting me be part of this and absorbing the amazing knowledge and energy of these incredible panelists. I'm super excited to have been here. Thank you.
Thank you, Dr. Gray. We appreciate you and your time. Best of luck. And as we conclude and wrap up for today, I just wanted to first and foremost thank all the panelists for being here. Dr. Harris, Ms. Sanchez, Dr. Vassell. I just appreciate you so much taking the time out of your day to just share these testimonies and experiences, resources to help the community out. And just the sheer nature of you just being here in this space just speaks to the sheer testimony of how TRIO works. I wanted to just briefly conclude with our TRIO Alumni Association for individuals who would like to learn more about how to become involved with the alumni community and how to continue to grow our alumni community across the country with TRIO. As Ms. Sanchez had mentioned, we have over 5 million TRIO alumni that are across the world, engaged in an incredible amount of work and that are doing transformational things for the community. And this particular association is really created to be a support system, to connect upcoming TRIO students with mentors and individuals who are in current fields to be able to assist them. Or if somebody's looking for a particular job or employment, they can connect with a TRIO alumni. This particular database and system here is really made to help support the TRIO community. So you can join that online with Facebook, Twitter, LinkedIn as well. That's our TRIO Alumni Association.com, and you'll be able to have more information on that. Also, as well, we are looking to highlight the stories of transformational, amazing TRIO alumni like yourself that are here on this particular panel. If that's so, please submit a Faces of TRIO story. That's the link right there. I could be also to make sure to share it with everyone. What we do is we create one-page testimonials about individuals who are involved in TRIO and to share their story of how TRIO works. Also, in addition to that, if you think there's a deserving individual in the TRIO community who on a national level should be recommended for the National TRIO Achievers Award, we are accepting nominations for that as well. Each year, we honor several individuals from across the country who are transformative individuals in the TRIO community, and we would like to consider any of those individuals in the TRIO community for that. Coming up soon, 2 events. We're going to have another alumni event. We're looking to have that July 9th. And our theme of what we're looking to cover is navigating finances in uncertain times. We'll get a panel together of some experts who are in financial sector to talk about what does it look like now? How do you navigate this financial aspect of financial security during COVID-19 and beyond? And we are going to have our annual conference as well, September 20th to the 23rd. That is going to take place in Texas, and we will await more information in regards to what that particular platform will look like, hybrid, digital, in-person experience, etc. But nonetheless, it is going to be taking place September 20th to the 23rd. It is 2:31 right now, so I do want to be cautious of your time, and I appreciate it. Thank you all for being the reason that TRIO works. If you have any other additional information, questions, comments, or concerns, or ideas, please feel free to reach out to me, justice.lopez@coenet.org. Thank you all so much for your time. Until we meet again. Thank you so much.
Thank you. It was a pleasure.
Absolutely. Thank you.
Thank you.